Great, great. So, hi everyone. Very good morning. So, after quite a bit of technical glitches, we have been able to get through the lot of things. आजकल इंटरनेट का ज़माना है. Internet is somewhat sluggish sometimes, and morning में पता क्या हुआ? Like the PPT, the presentation which I had made, it somehow had some problem. It was not uploaded online, and therefore there was a different version of the presentation which was there. Anyways, sorry for the delay. It was all on our technical side. Good morning everyone. I hope it is audible and it is visible. So today I'm सर आप फॉरेन में हो या इंडिया में हो? हम फॉरेन इंडिया आ जाते हैं, फॉरेन इंडिया आ जाते हैं, है ना? सो या आई एम इन इंडिया, बैक होम यहीं से कर रहे हैं. सो यहीं पे आपके लोगों के साथ तो रहता हूँ यार. साल में 2 दफ़ा अगर मैं बाहर जाता हूँ तो क्या प्रॉब्लम है? सो या, it's nice to see you all. Let us take on some of the MCQs with some of the MCQ topics which are definitely predicted in all the nursing NORCET exams. And जो भी आप एग्ज़ाम दे दो, ये कॉमनली रिपीटेड क्वेश्चंस है. हाँ, जो नॉर्सेट के फेवरेट टॉपिक्स हैं वो ऑफ कोर्स आई विल बी डिस्कसिंग, and I hope everybody is okay with both English and Hindi. But anyways, the medium on this whole session would primarily be in English. Let us take on the first question. The game will be that beta, whatever topics we are discussing, okay, don't take this question as it is, but whatever topic we are discussing, वो टॉपिक आपको पढ़ना है. एंड वो टॉपिक को अच्छी तरह आपने मतलब यू शुड बी नोइंग एवरीथिंग, ऑलमोस्ट एवरीथिंग इन डिटेल. So this whole session I'm not be able to teach the whole topic, but yes, I'm able to tell you that what all things you need to remember. And सर अपडेट्स वाले भी करवा देना. या अपडेट्स तो आई थिंक अभी रिसेंट वी हैड टेकन दिस क्लास, एंड वो क्लास लाइव में भी थी, एंड इट इज़ देयर इन योर मोबाइल एप्स ऑल्सो. उसमें डे 5 पे वी डिस्कस्ड ऑल द recent updates, so that all recent updates is there. What do you think of this question, beta? What is the schedule for pre-exposure prophylaxis in rabies vaccination? सो प्री एक्सपोजर प्रोफाइलैक्सिस, कुछ लोग इसमें ऑप्शन डी कह रहे हैं, कुछ लोग ऑप्शन बी कह रहे हैं, बट सम आर सेइंग बी, सम आर सेइंग डी. ओके, ओके, आई जस्ट होप we all should know कि what are the different prophylaxis beta. There is a post exposure, pre exposure and re-exposure prophylaxis. Post exposure, when do we give it? This is after the dog bite. It is after dog bite, and there are two regimes beta. We can have something called as SN regime. What is SN regime? SN regime is intramuscular injections, and this is given as what is the dose? It is complete vial. Complete vial will be there. Okay, complete vial will be there, and this is given on day 3, 7, 14 and 28, and it is one dose per visit. It is one dose per visit. Coming to another regime which is available in post exposure, it is the Thai Red Cross regime. Thai Red Cross regime. The Thai Red Cross regime beta, it is intradermal regime, and इसकी जो डोज रहेगी that is 0.1 ml intradermal injection, and it has to be given as two doses per visit. 2 doses per visit. It is given on day 0, 3, 7 and 14 वाली cancel होगी day 28. So that's the whole story about the Thai Red Cross and the SN regime. Next is pre-exposure. Pre-exposure prophylaxis. किनको मिलेगा? Who will get pre-exposure? It is given to all high-risk occupation. high risk occupation, people who are working as maybe dog handlers or veterinary doctors, and it is given on three doses, which are 0, 7 and 21 or 28. So इस हिसाब से 0, 7, 21, 28, which is the best answer for you guys to mark? The best answer will be 0, 7, 21 and 28. Coming to the next one, that is what is the re-exposure prophylaxis. बच्चे re-exposure prophylaxis is given after dog bite or repeat dog bites. It is given to previously immunized. याद रखेंगे इस पे MCQ विल बी देयर एंड एग्जामिनर आपके साथ गेम खेलेगा. यू हैव टू मेक श्योर दैट यू डोंट प्ले विद द एग्जामिनर. आपको उससे साइड हो लेना. एग्जामिनर विल से दैट the patient had a dog bite before but never took immunization. Now they get the dog bite again. Will you give post exposure or re exposure? Please note, अगर previously dog bite में उसने वैक्सीन नहीं लिया, then we are not going to give the post exposure again. We are not going to give the re exposure. We will give the post exposure. Yeah, I know there is some lag over here. वो बीच बीच में the internet might be a little bit etchy. So we'll try to figure it out, but that's how it is. Yes, I know it is a little bit lagging right now. Uh, yes, I think वो लोड पड़ रहा है उसके ऊपर. Just give me a moment. I'll just see what best I can do. Just give me a moment. I just shifted the place to somewhat which is near to me. अब देखिए if it is all okay. Is the audio fine? Is the audio fine right now? I shifted my place. Okay. So if the audio is fine, ये light off कर दो और सामने वाली on कर दो. वहाँ से. और वो पीछे वाली भी ऑफ कर दे lights. So I just got place shifted and yeah. वो कर्टन करना. चलो, वेरी नाइस. अरे भैया ये वाला नहीं, क्या कर रहे हो? इधर वाला ठीक करो, सेंटर वाला. ये लाइट बंद करेंगे ना, लाइट सोर्स वी हैव टू स्टॉप. सर बस पीछे से जो उसको बंद कर दो. दैट्स व्हाट आई एम ट्राइंग टू डू. पीछे की लाइट्स ऑफ. ये अभी भी आ रही है. Yeah, I think it's fine. Yeah. So let us talk about the. We were at rabies vaccine schedule. We are talking about the rabies vaccine schedule, beta. There are two types of schedule. We can have pre-exposure and post-exposure. मैं ये बता रहा था, examiner will play with you when they talk about the re-exposure prophylaxis. So they will talk with you when they talk about the re-exposure. Re-exposure में आपने एक बड़ी ज़रूरी बात का ध्यान रखना है, that you have to make sure that you don't fall into the trap. एग्ज़ाम में लिखा होगा कि एक person has already have a dog bite maybe 5 months ago and उन्होंने dog bite में there was no vaccine which was given. And next time again repeat dog bite होगा and now they are coming to you for vaccination. Will you give a re-exposure or will you give a post-exposure? इस scenario में we are going to give a post-exposure because re-exposure किनको मिलेगा? जो previously immunized लोग हैं. So previously immunized, it could be beta anything. It could be pre-exposure, previous pre-exposure वाला लिया हो, that is ये वाला लिया हो, या फिर पहले post-exposure लिया हो, anything. In those cases, if the person has taken previous immunization which is more than 3 months ago, 3 महीने से ज़्यादा, then we are going to give day 0 and day 3 पे re-exposure prophylaxis. Right? Okay. So this is what is re-exposure, pre-exposure and post-exposure. A small update for you. Update is that now we have monoclonal antibodies. Now we have these monoclonal antibodies. Though monoclonal antibodies are can be used in rabies treatment and prophylaxis. After dog bite, we can have something called as twin rab beta. Twin rab is docaravimab and miromavimab. These twin rab जो monoclonal antibodies हैं, these have been used in India and these are monoclonal antibodies. They are used in place of, they replace the rabies immunoglobulin. That's a kind of update for you. So instead of rabies immunoglobulin, we can also give the monoclonal antibodies. So absolutely correct. What is the schedule for pre-exposure prophylaxis? The schedule for pre-exposure prophylaxis is 07 and 21-28. नेक्स्ट क्वेश्चन को देखो, एट अ पीएचसी क्लिनिक बेटा द फॉलोइंग वैक्सीन्स आर अवेलेबल एट द स्टार्ट ऑफ सेशन, ऑल वर स्टोर्ड एट 2 to 8, हैड इंटैक्ट लेबल्स एंड सेप्टा, विच वैक्सीन कैन बी सेफली एडमिनिस्टर्ड. सो बड़ा अच्छा एमसीक्यू है, विच वैक्सीन कैन बी सेफली एडमिनिस्टर्ड इन दीज केसेस. BCG reconstituted 4 hours earlier, inner square darker than the outer circle. OPV 26 days earlier, inner square matches the outer circle. Pentavalent 21 days, inner square lighter than the outer circle. MR vaccine 5 hours ago, inner square lighter than the outer circle. Which one do you think is the best answer in this case? Which one you think is the best answer in this case? Either से. I'll just put the charger. We forgot the charger. इसमें लगाओ, इसको यहाँ पे रख दो, ये बॉक्स इधर दे दो, बॉक्स. So I think this area is also much better. I think you are not having any problems with the, ये लगाना है. Yeah, so most of you are going with option number C, है ना? Most of you are going with option number C. At a PHC clinic, the following vaccines. At a PHC clinic, the following vaccines are available at the start of session. तो कौन सी vaccine लगाएंगे? Which vaccine can be safely administered? I think most of you are answering correctly. So please note option A. इसके लिए basic you need to know is what is a vaccine vial monitor. That is the only thing you need to know. What is a vaccine vial monitor, beta? Vaccine vial monitor. In a vaccine vial monitor, you will have the inner square, outer circle. है ना, ये तो याद होगा. So what is the discard point? Let's quickly revise the cold chain. What is the discard point? बेटा the discard point, if you recall, discard point कौन सा होता है? Discard point जहाँ पे same हो color, same color of the square and same color of the circle. That is what is the discard point, right? So this is what is the vaccine vial monitor. So discard ये same color भी होगा and discard जहाँ पे outer the outer circle is lighter या inner square is darker, that is also the discard point. सर आपने मिड डे मील नहीं पढ़ाया, आप मिड डे मील पढ़ लेना, क्योंकि मिड डे मील प्रोग्राम ही बंद हो गया तो इसलिए मैंने नहीं पढ़ाया. अगर आपको पढ़ना है, अगर आप पिछले 5 साल पहले एग्ज़ाम देंगे तो आपको मिड डे मील पढ़ना पड़ेगा. बट नाउ बेटा मिड डे मील बंद हो गया, इसलिए गरीब बंदे ने नहीं पढ़ाया क्योंकि मिड डे मील बंद हो गया है. सो पुरानी चीज़ें क्यों पढ़नी ना, ऐसे तो आपको मैंने 1982 के प्रोग्राम्स भी नहीं कराए. What will you do by these 1982 wale programs, right? So same color is the discard point. So BCG reconstitute, and second point you should know. Second point you should know that there is also called as open vial policy. What is open vial policy? Open vial policy कहती है that all the vaccines they should be discarded after 28 days. 28 डेज तक आप उन्हें अगर खोलते हैं तो आप उन्हें यूज़ कर सकते हैं. आफ्टर 28 डेज वी हैव टू रिटर्न देम और वी डिस्कार्ड देम. ओके, सो ओपन वायल पॉलिसी डज नॉट apply to which vaccines? It does not apply to BCG and measles rubella vaccine. It does not apply to BCG and measles rubella. Very quickly write it on the chat box. Very quickly write it on the chat box that which vaccine is the heat-killed vaccine. Heat-killed vaccine, and which vaccine is heat-sensitive, not heat-sensitive vaccines. And which vaccine is the most freeze-sensitive vaccine? फटाफट से in the chat box, I need it. So, absolutely Kaushik Rai got it. Mid day meal रहता तो मेरे नाना पढ़ाते. Yes, पोषण माह. So can you tell me which one is the heat sensitive and the freeze sensitive vaccine? I'm waiting for your answers. I'm waiting for your answers. So अगर आप लोग ये समझते हो that what is open vial policy and if you know that what is the vaccine vial monitor, please take it that let's see the MCQs options. BCG reconstituted 4 hours earlier. Yes, it is okay to use. Inner square is darker. नहीं, darker हो गया ना तो it cannot be used. Okay, we started getting the answers. Rotavirus vaccine, OPV. Absolutely correct. Very nice, beta. Most heat sensitive is OPV, followed by OPV, followed by measles and rubella, followed by BCG. अगर MCQ में आ जाए बाई चांस समवन आस्क यू दैट रिकॉन्स्टिट्यूटेड, अगर देखो लिखा हो तभी आंसर का मार्क करना है, अदरवाइज डोंट रिमेंबर माय वर्ड्स. अगर MCQ में आ जाए बेटा रिकॉन्स्टिट्यूटेड BCG, that is taken as the most heat sensitive, so that will be here. But if normal vaccines without reconstitution पूछा जाए तो which is the most heat sensitive, it is OPV. OPV. Very nice, Anshika. Very nice, Anshika. Absolutely correct. You have given the explanation also. So proud of you, bache. So next is, what is the freeze sensitive? Which are the freeze sensitive vaccines? Freeze sensitive vaccines, very nice. That is hepatitis B followed by pentavalent followed by PCV vaccines. Absolutely correct. Very, very nice. So let's come back to the MCQ. BCG reconstituted 4 hours earlier. Inner square is darker than the outer square. This is a false answer. OPV opened 26 days earlier. Yes, it is okay to use. Inner square matches. Matches ho gaya na, so this is also a wrong answer. Pentavalent opened 21 days. Yes, it is correct. Inner square is lighter. Yes, it is also correct. So which is the best one to use? Option C. MR vaccine reconstituted 5 hours. 5 hours, but beta, it is incorrect. It should be used within 4 hours. MR vaccine should be used within 4 hours. Inner square is lighter. Lighter, yes, this is okay. So that is your best answer for your exams. And which is the single best answer you would like to mark correct in your exam? It is pentavalent open 21 days earlier. Inner square is lighter than the outer square. Okay. So please remember, open vial policy बहुत दफा पूछा हुआ है. Vaccines if open should be used within how many days? 28 days. 28 days. 5-star MCQ frequently asked in your exam. एक और बताओ, एक और बताओ. I'll not wait for your answers because I know there's a lag kind of thing. But जब भी आप आंसर करेंगे तो I'll take it from you. ओपन वायल पॉलिसी बेटा, चलो ओपन वायल पॉलिसी को छोड़ो. कैन यू प्लीज टेल मी दैट विच, पहला सवाल, which product is kept on the top shelf of the ILR? Which product will be kept on the product is kept on top shelf of ILR? Which product is kept on the top shelf of ILR? Very, very frequently asked MCQ. So I'll not wait for your answers, but please tell me. Point number 2, which vaccine is both heat and freeze sensitive? Which vaccine is both heat and freeze sensitive? फटाफट से करिए आंसर and let's see if you can remember this. And last point, what is the site for PCV vaccine? ये 3 MCQs हैं. Let us see how you answer them. What is the site for PCV vaccine? Let's see how many of you can answer it. So we have already started getting the answers. The first answer is product is kept on the top shelf of ILR. It is the diluents. Very, very nice. It is the diluents. Which vaccine is both heat and freeze sensitive? Which vaccine is both heat and freeze sensitive, and what is the site for PCV vaccine? Let's see if you can answer this. I'll come back to this answers. Which of the following is not correct for contraceptive use? Antra is contraception. It is a 5-star MCQ, beta. It is a 10-star MCQ. Definitely there will be one MCQ on either of these contraception. Antra, Centchroman, Copper 375, IPIL. In चारों में से out of these four, I can almost guarantee you at least one MCQ. Antra, Centchroman, Copper 375, and IPIL. So can you please tell me which of the following is not correct for contraceptive use? So Antra is given every 3 months. Centchroman is given every week. Copper 375 is valid for 10 years. IPIL to be given within 72 hours. तो टाइमिंग को लेके अब अगर हम बात करें तो which one is the not correct answer? Antra is given every 3 months. Antra, let's very quickly revise all these contraceptives. Antra beta. Antra is intramuscular injection 150 milligrams. It is given every 90 days. And Antra jo hai, it can be given 2 weeks before and it can be given 4 weeks later on. So after the due date, it can be given 2 weeks before and 4 weeks later on. Centchroman jo hai, it is given at the dose of 30 milligram of Centchroman. It is given as weekly tablets and it is started as bi-weekly for 3 months. And after 3 months, we put it to the weekly tablet. And if the female missed the Centchroman, she can take within 7 days anytime. She can take within 7 days. Next is Copper 375 beta. Copper 375, it is a multi-load device. This Copper 375 is valid for 3 to 5 years. If you get single best answer, please mark 3 years. If you get single best answer, please mark 5 years. That is the multi-load device. It is a short-term IUCD. And this multi-load device, it is an inverted U-shaped device. And this inverted U-shaped device, it has stubs on it. Stubs will help in better attachment and easy install. Better attachment to the uterine myometrium and easy installation. And this multi-load device, it has a specific nylon thread which is blue-green in color. Nylon thread, Copper 375 multi-load device. Next is IPIL. IPIL is given as a single tablet within 72 hours. Yes, this is the correct answer. It is given within 72 hours of unprotected intercourse. It is given as single tablet 1.5 milligrams of IPIL. So which is the only wrong answer you need to mark? Which is not correct? आपको not correct ढूंढना था ना? So not correct is Copper 375 is not valid for 10 years. Copper 375 is valid for 3 to 5 years. So Copper 375 को पेशेंट में क्यों प्रेफर नहीं करते? Because what is the side effect of copper teas? What are the side effects of copper teas? Side effect of copper tea, the female may have pain, the female may have bleeding. And because there is more bleeding, because there is more chances of bleeding, that is the reason it is given with caution. It is given with caution to females who have heavy menstrual bleed, and along with that, heavy menstrual bleed, and along with that, if the female is having chances of anemia or low hemoglobin, un cases mein IUD will not be a very preferred method of choice of contraception. So which is the best answer? It is Copper 375 is the best answer. Centchroman given weekly, Antra is given every 90 days. Coming to next one, as per the guidelines. Acha, haan, most of you have given the answers. Let me give you the answers for this. The product which is kept in the top shelf of ILR, is diluents. The product which is kept in the bottom shelf of ILR In bottom shelf of ILR, it is OPV. Please remember, at the lowest most shelf, it is OPV. At the topmost shelf, it is diluents. Which vaccine is both heat and freeze sensitive? The vaccine which is both heat and freeze sensitive is FIPV. If FIPV is not in the option, please mark rotavirus. But which is a better answer? It is FIPV. Site of the PCV vaccine. Please remember that the PCV, pneumococcal conjugate vaccine, it is given as intramuscular injection. It is given in the right anterolateral thigh. It is given in the right anterolateral thigh. Okay, so I think that was all. Anthra is for anemic females, yes, but please note that Anthra will have a slightly higher failure rate compared to occipils, okay? So that's the only problem. But yeah, they have a good efficacy. As per the guideline given shown, as per the guidelines for the image shown below, the target for TFR is, how much is the target for TFR? TFR 1, 1.2 or 2.1 और 60%. व्हाट डू यू वांट टू आंसर? पहले तो आपको यही ढूंढना पड़ेगा कि ये इमेज किस चीज़ की है एंड उसके बेस पे इस इमेज के टारगेट्स क्या हैं फॉर TFR. So what do you think are the targets for TFR? Beta, whenever you see, I think most of you have got it. Very nice. Whenever you see an inverted triangle, that is the symbol for family planning. That is the symbol for family planning or contraception. And family planning, contraception, beta, it is under something called as Mission Parivar Vikas by Government of India. Mission Parivar Vikas. So as per the Mission Parivar Vikas, please remember that what are the guidelines? The guidelines are that we want to have a couple protection rate. We want to have a couple protection rate of more than, please remember, it is more than 60%. If we get a couple protection rate of more than 60%, then we need a total fertility rate of less than 2.1. And if we have a fertility rate of 2.1, the net reproduction rate will be equal to 1. These are the targets of the Mission Parivar Vikas. These are the targets of Mission Parivar Vikas, where we are talking about couple protection rates, total fertilities, and net reproduction. What is total fertility? Please remember, it is the average number of children a female is expected to bear. Please remember, it is the average number of children. Okay, it's about the fertilities. So whenever the MCQ will say fertility, you think about children. Average number of children a female will bear, assuming the same rates as the reproductive rates as per the age-specific fertility rate. This is in English, we call it as total fertility rate. इसको क्या हम बोलते हैं? टोटल फर्टिलिटी रेट. नेक्स्ट इज एग्जामिनर में आस्क यू व्हाट इज नेट रिप्रोडक्शन रेट. नेट रिप्रोडक्शन रेट इज द टोटल नंबर ऑफ daughters a newborn girl child is going to bear during her entire life, assuming the specific age specific fertilities and mortalities. ये mortality याद करना बड़ा ज़रूरी है. याद रखना reproduction rate daughters में है. अगर ये याद कर लिया, please remember net reproduction rate, if it is 1, to have NRR 1, the TFR should be 2.1. To have TFR 2.1, the couple protection rate should be more than 60%. What is the current value, beta? जो करंट वैल्यू है CPR कितना है? दैट इज 67%. जो टोटल फर्टिलिटी रेट है दैट इज 1.9 बेटा. टोटल फर्टिलिटी रेट इन इंडिया इट इज 1.9. Total fertility rate in India is 1.9 and the net reproduction rate currently it is roughly somewhat almost equal to 1, but that is what the target is. एग्जाम में आपसे TFR and CPR का पूछेंगे. TFR is 1.9, CPR is 67. Coming to next MCQ, which of the following is not a correct space criteria? सर फॉर कॉन्ट्रासेप्शन बेस्ट इज CPR और TFR. TFR और CPR में अगर कभी चॉइस आ जाए आपको, ऑलवेज मार्क TFR because that is a good indicator about the contraceptive use and actually how many number of children a female is going to get in the community or in the population. Which one is better? CPR is just for ANMs and for healthcare workers better. So CPR is a field indicator, but which is a better epidemiological indicator for contraception use? Contraception use, the best indicator is TFR. Impact indicator, impact or evaluation indicator, that will be NRR. Coming to next one, which of the following is not a space criteria? कौन सा नहीं है space criteria? Which of the following is not correct space criteria? More than 500 square feet for worker, 10 square feet for child and student in the class, 90 square feet for one person in a room, 110 square feet for two persons in a room. So which one do you think is not the correct answer? You have to find the false one, which is the not correct answer. Some of you are going with A. I don't know why. Which is the not correct answer? Most of you are going with A. Previous question का answer the target for TFR is 2.1. Okay. इसमें most of you are going with A, which is not correct. तो correct क्या है? What is the correct answer? Everybody unanimously answering A. So what is the correct answer? अगर ये correct नहीं है, oh yeah, okay, you got it. Okay, it is 500 cubic feet. Okay, my mistake. I made this MCQ, but it is not 500 square feet. It is 500 cubic feet. 500 cubic feet. Yes, this is the wrong answer. It should be 500 cubic feet. Correct. More than 10 square feet is correct, beta. This is also wrong answer. This is also wrong answer. It is not more than 90. Is question galti se, there's a mistake in this question. So option A and option C both are wrong. 110 square feet for 2 person. This is true answer. See beta, as per the Factories Act, Factories Act के तहत we need more than 500 cubic feet of space per worker. And school health program में it is 10. This is correct answer. And अगर overcrowding criteria बात करें, overcrowding criteria में बेटा one person should have area more than 70. It's not 90. More than 70 square feet. And two persons should have area more than 110 square feet. Okay. And three persons अगर हो जाएं, it should be more than 150 square feet area. And that is the minimum requirement to be called as overcrowding. That is the minimum requirement to be called as overcrowding. So which is not a space criteria. Please remember, ठीक है आपने ये पकड़ा MCQ को. This is A is wrong. Why? Because it's not square feet and obviously it's not 90 as well. So these both are kind of incorrect answer, but please note overcrowding is an important topic and will be asked to you in the exam. Coming to next one, as a public health officer, you are evaluating the implementation of intensified mission Indradhanush in your area by finding the coverage rates of fully immunized child who have completed all due vaccines till what year? So what do you want to answer? As per the beta criteria of the intensified mission Indradhanush, let's just quickly go through the IMI 5.0 guidelines. As per the IMI 5.0 guidelines, beta, this is new update for you guys. This is an update for you guys. As per the IMI 5.0 guidelines, we want to have more than 90% coverage across India. And we want to have more than 100% coverage in urban slums. And because आपको 100%, not more than, like it's 100% coverage. We need 100% coverage in urban slums and more than 90% coverage in the total pan India in rural and urban. So what are we talking about? Are we talking about fully immunized or completely? So there are two people. So there are two people, beta. We can have something called as fully immunized child. And we can also have something called as completely immunized child. Who is a fully immunized child? Fully immunized child is a child who has completed all due vaccines. All due vaccines till how much time? All due vaccines till 1 year of age. जिन बच्चों ने अपनी सारी वैक्सीन्स 1 year of age तक लगवा ली हैं, first year of life is fully immunized child. And if the child has completed all due vaccines within 5 years, till 5 years of age, 5 years के बच्चे ने 2 year वाली, who has taken all due vaccines, जो second dose है, second dose vaccines, second year of life wala vaccine, 16, 24, 5, 6 years wala. So all the child who is immunized till 5 years, we call it as completely. And till first year vaccine, remember first year is fully immunized. What age group you check this? 12 to 23 months. 12 से 23 महीने के बच्चों में we will check the fully immunized child. Why do we say like this? Because this is the vaccine schedule you already know, beta. This is the vaccine schedule which you already know, right? So because you already know this vaccination schedule, you know that this is UIP, you know that this is the UIP, Universal Immunization Schedule. You know that this is the Universal Immunization Schedule. इस Universal Immunization Schedule में बेटा, in this Universal Immunization Schedule, in this universal immunization schedule, beta, at birth, which vaccines we are giving? At birth, we are giving BCG, OPV 0 dose and hepatitis B birth dose 6, 10, 14 pe OPV 1, 2, 3, Penta 1, 2, 3, Rota 1, 2, 3. And at 9 months of age, we give measles, rubella first dose, JE first dose, FIPV third dose, and pneumococcal conjugate vaccine booster dose. ये सारी जो vaccines है बेटा, all these vaccines, these are called as the primary schedule vaccines. These are called as the primary vaccines or the primary schedule vaccines. यहाँ से we start with the second dose. So a child who has completed all the primary schedule vaccines, these are called as fully immunized child. This is what is a fully immunized child. This is what is a fully immunized. एक third definition भी है, that what do we mean by a zero dose child? What is a zero dose child? Zero dose child कौन होता है? Zero dose child is a child who has not taken the pentavalent first dose, not taken. So a pentavalent first dose not taken is called as a zero dose. अगर बच्चे ने BCG लगवा लिया, MRB लगवा लिया, but the child has not taken the pentavalent or the pentavalent first, second, and third, this child is called as a zero dose child. So the child, we say that he is still at the zero dose. So based on this intensified mission Indradhanush, when will you say that a child is fully immunized? When will you say that the child is fully immunized? We will say a child is fully immunized child, a child who has taken all due vaccines till 1 year of age. So a child who has completed all due vaccines, measles, rubella vaccine within 1 year of age, that child is called as a fully immunized child. Let us go to next MCQ. Choose the most appropriate option regarding reference Indian adult male. Age is 1939, weight is 75 kg, BMI 20.75, height is 1.77. So which one do you think is correct answer? Which one do you think is correct answer? Choose the most appropriate option regarding Indian adult. So most of you are going with option A. 1 and 3 is incorrect. 1 and 2 is incorrect. Only 2 is incorrect. Only 3 is incorrect. Which one do you think is the wrong answers? Most of you are going with option A. 1 and 3 is incorrect. Okay. So now most of you are go for this question. Yeah. So yeah, absolutely correct, beta. What is a reference Indian adult? Reference Indian adult male, their age is 19 to 39 years. The weight is 65 kilograms. 65 kilograms, and for reference Indian female, beta, the weight we take is 55 kilograms. The BMI is 20.75, and that is correct. The height should be 1.77 meters. So that is also correct. Which is the only one which is incorrect? It is weight is 75. Weight is not 75, weight is 65 kilograms. And his base pay only 2 is the incorrect male. Incorrect answer. A very quick revision about the nutritional guidelines, beta. Nutritional RDA guidelines. RDA guidelines. अगर आपको याद हो for energy, what is the guideline? Very quick. This is a 10-star chart I'm sharing with you. Energy, beta, it can be for a male, it can be for a female. Male, do you remember it is 2100 plus 600, yes, 700. And for female, it is 1660 plus 500 and 600. In case of point number 2, in case of pregnant female, in case of pregnant female, the first trimester, second and third trimester, first trimester 70 to 80 kilocalories extra. In the second trimester, it is 230 to 280 kilocalories extra. And in the third trimester, 370 to 490 kilocalories extra per day. That is for the pregnant female. Point number 3 is what about the lactating female? Lactating female, she will take for 0 to 6 months, she'll take 600 extra, and 6 months to 12 months, she'll take 520 kilocalories extra per day. So that is for energy for male, female, pregnant female, and for lactating. And if they ask you per kg body weight, if they ask you per kg body weight, remember there is a rule of 40, 40, 50, 60, 70, and 80. What is all this? 40 is for any female, adult female. 40 is for female. 50 is for males. 60 is for adolescent children. 70 is for children. And 80 is for infants. This is per kg body weight. This is per kg body weight. This is the total recommended dietary allowance for energy. This is the total recommended dietary allowance for energy. Energy के लिए. And I hope if you recall, what is the recommended dietary allowance for the micronutrients, beta? Calcium कितना चाहिए था? Calcium. Calcium, how much was required for male, for female, for pregnant female, for lactating female? Calcium was same answer, 1000, 1000 and 1000. Lactating is 1200, right? Lactating female will be 1200. And how much was for the iron? If you recall, iron is 19, 29, 27, 23 milligrams a day. Milligrams a day. Next was vitamin A. How much vitamin A do we require? Male is 1000 micrograms a day. Female is 850, 900, 950 micrograms per day. Micrograms per day. Right? So that is what is a very quick review. Fourth was iodine also. Iodine, beta, 150 milligram for male, 150 microgram, not milligram. It is 150 micrograms per day for males or for females. Pregnancy will be 250, lactating will be 280 micrograms per day. ये सारे 5-star MCQs हैं, nutrition के आपके MCQs हैं. You need to revise them. Make sure you take a screenshot of this and keep it safe for your exam. And just look at these numbers before your exam. I think they should be able to help you all. So what is the best answer you would like to mark? Only 2 is the incorrect answer. Let us go to the next one. A new campaign. This is a direct question, direct answer. I don't have anything to solve over here. A new campaign has been launched with the theme Healthy Women, Empowered Families, which aims to promote screening of females and adolescent girls for anemia, non-communicable disease and reproductive health through Ayushman Arogya Mandir. Which of the following does this describe? Mission Shakti, Swasth Nari Sashakt Parivar, Pradhan Mantri Surakshit Matritva Abhiyan, Pradhan Mantri Matru Vandana Yojana. So which one do you think is the correct answer or the best answer in this question? So in this is again a recent update. It is a recent update for you guys. It is a recent update for you guys that there is this new campaign, healthy family and healthy women and empowered families. So this is beta a theme for the Swasth Nari Sashakt Parivar Abhiyan. Mission Shakti, what is Mission Shakti? Mission Shakti, it is a mission which is to promote women empowerment through security and through safety measures. There is a Sambal scheme and a Sambhal scheme and a Sashakt scheme, Sambal and Samarthya scheme. This women empowerment, it is under Ministry of Women and Child Development. It is not directly under Ministry of Health and Family Welfare. So Pradhan Mantri Surakshit Matritva Abhiyan, this is for early ANC screening and high risk female identification. It is to identify females who are at high risk. That is what is Pradhan Mantri Surakshit Matritva Abhiyan. Matru Vandana Yojana, it is under the Ministry of Women and Child Development. Matru Vandana Yojana is to give incentives. How much incentive do we give in Matru Vandana? We give 5,000 rupees for the firstborn child and 6,000 rupees for the second child only if it is a girl child. 6,000 rupees for the second child only if it is a girl child. So which is the best answer you would like to mark over here? Swasth Nari Sashakt Parivar is the best answer for this question. Coming to next MCQ, which of the following are objectives of Integrated Child Development Services? Integrated Child Development Services, which of the following are the correct objectives? So reduce malnutrition, morbidity, mortality and school dropouts, provides formal primary education, intersectoral coordination, mother's ability to meet nutritional needs, reduce IMR by ensuring institutional deliveries. So which of the following are objectives of ICDS? Which one do you think is the correct answer? So yeah, which one do you think is the correct answer? So which of the following are objectives of the ICDS scheme? So under the ICDS scheme, beta, it is to reduce malnutrition, morbidity and school dropouts among children. Provides formal education. It is not a formal education. This option A, it may be true, it may be false because it's not actually about the school dropouts. But yes, it is to reduce malnutrition, deaths and sickness in the children. It does not provide a formal, it's in fact the opposite, it is a non-formal education. So intersectoral coordination, yes, this is correct. Improves mother ability to meet the child nutritional, that is also correct. Reduce IMR. Infant mortality is not the this thing. It is the main answer, but ensuring institutional deliveries, that is not the correct answer. So which is the best answer you would like to mark? You can go with option 3 and 4 correct answer, but 1 is kind of okay answer. So 1, 3 and 4 would be the best answer for you guys to mark. Okay. Coming to next one. A newly recruited immunization officer finds ILR has a temperature of 16 degrees Celsius for 10 hours overnight. Vaccines are although placed in the cold box and delivered outreach. Which of the following statement is correct? So do you think the vaccine should be used? Do you think? And moreover, it's not about the primary. Yeah, 3 to 6 years is also correct. That is incorrect. So vaccines are placed in cold boxes. Yes, absolutely correct, beta. What is the temperature for a cold chain? Temperature kitna hota hai for a cold chain? Cold chain, the temperature is 2 to 8 degrees Celsius. Cold chain, the temperature is 2 to 8 degrees Celsius, plus 2 to plus 8. Agar ye 16 degree hai, obviously, which is the single best answer you would like to mark? None of the vaccines should be used and the supervisor must be notified. That is obviously the same answer or the best answer. you would like to mark. Which of the following represents the frequency of continuous variables? There are a few questions from medical and biostats and nursing research. Which of the following represents the frequency of the continuous variables? Continuous variables. Histogram, line chart, simple bar, or a Venn diagram. So if you talk about each of them, beta, what is each of them? So what is histogram? Histogram is a joint column chart and it is for quantitative data. Line diagram is for time and frequency. Simple bar chart is a distantly placed column chart. It is for qualitative variables. It is for qualitative variables. And Venn diagram is for overlapping qualitative data. So which of the following represents the frequency of the continuous variable? Histogram, yes, this is correct. Line chart, no, this is false. It represents the difference between the time and frequency. It is the difference between the time and the frequency. Bar chart is for qualitative, it is not for continuous. Venn diagram is for overlapping qualitative data. Overlapping qualitative data. So which is the single best answer you would like to mark? That is histogram. Coming to the next MCQ, a middle-aged sedentary male was diagnosed with essential hypertension. While presenting the case history of the patient, a final year nursing student was asked about the rule of halves pertaining to hypertension. What does it mean? 50% of the hypertensive patients of general population are aware, 50% are treated, 50% are adequately treated, and 50% of general population are aware about the complications of hypertension. What do you think is the correct answer? Which one is the correct answer? So that's kind of a little bit confusing options, but yeah, if you just look at them, अगर ध्यान से देखोगे तो आपको बड़ा आराम से दिखेगा आंसर. So 50% beta, what is a rule of halves? Rule of halves बच्चे, this is the rule of halves. This is the rule of halves. ये कहता है कि पूरी general population में, this could be your MCQ, it says that in the total general population, in the total general population, beta, this is the total general population. It says that in the total general population, whatever number is hypertensive, generally different research ने different answers दिया, 15 to 20% hypertension होता है. So out of this 15 to 20% are hypertensive. अब कहा जाता है जितने भी total यहाँ से rule of halves शुरू होता है. So whatever number of hypertensives we have, उनमें से do you know that 50% are diagnosed, 50% are on treatment, and 50% will have control, adequate control of BP. This is what is the rule of halves. This is what is the rule of halves. अगर ये समझ गए, direct question, direct answer है. 50% of hypertensive patients, जितने hypertensive हैं, उनमें से 50% are aware of the condition, that is they are diagnosed. Yes, this is true answer. Next is 50% of the hypertensive patients are treated for the condition. This is also true answer. 50% of the hypertensive are adequately treated. No, this is false answer, because ये जो adequate treatment है, that is not 50% of this. Obviously, this is false answer. 50% of hypertensive are aware of the complication. This is also false. It's not about the aware. अब option आपको A और B में से choose करना है. 50% of hypertensive patients of the general population are aware of having condition. This is a true answer. 50% of the hypertensive patients of general population are treated for condition. What do you think? ये hypertensive का treatment ले रहे हैं या फिर hypertension का diagnosed? So which is a better answer? Obviously it is option A is the best answer. Option A is the most correct answer. ये जो है ये false हो गया. Because total 50% का treated नहीं है ना, 50% का तो aware है. Are we able to get it? So option A, absolutely correct. Option A is the most correct answer. B नहीं है. Many students I made B because some students answered B as well, which is the wrong answer. Which please try to understand total hypertensive का 50% is diagnosed, 50 is treated, 50 is adequately treated. Coming to next MCQ, which of the following statement is not true regarding the incubation period? Which of the following statement is not true regarding incubation period? Incubation period. So which of the following is not true? आपने झूठ वाला बताना है. Quarantine is advised for period equal to the maximum incubation period. Diseases like measles are not communicable during incubation period. Immunization of the exposed during incubation prevents the clinical illness. In case of point source, all cases will happen within one incubation period. What do you think is the best answer? What do you think is the single best answer? What do you think is the single best answer? So talking about what is isolation and what is quarantine, beta. What is isolation? Isolation, beta, it is for diseased individual, जो लोग बीमार है. And ध्यान से सुनना, it is a very big headache for me because most of the time students will keep on answering the same, asking the same question again and again. So what is isolation? Isolation will be for diseased individuals. Mainly अगर एक बंदा है and if we say भैया we need to isolate you, why do you isolate this person? Why? To treat this person or to prevent the spread? It is to prevent the spread, and because it is to prevent the spread in others, therefore this is called as, therefore this type of prevention, it is called as a primary level of prevention. It is a primary level of prevention. What do we mean by primary level of prevention, beta? What is a primary level of prevention? Primary level of prevention is जहाँ पे आप risk factor is there and you prevent the disease. The main game is you prevent the disease. What is a secondary level of prevention? Secondary level में disease may be there, but you prevent the complications. If you prevent the complication, that is the secondary level. जब भी screening का question आए, screening is always a secondary level of prevention, and immunization or vaccines, it is always, any type of vaccine, it is always a primary level of prevention. कभी भी आपको कोई बीमारी diagnose करनी है, treat करनी है, everything is secondary level of prevention, and these are the two things which are most commonly asked. अगर कोई lifestyle modification पूछे, if someone asks you lifestyle modification, that is generally taken as a primordial level of prevention because you are preventing the risk factor from coming up. So that is what is this level of prevention. It's a big headache for me. Many students ask this most of the times, that what is isolation? Isolation, is it primary or secondary? करते तो disease के लिए हैं, but it is not secondary. It is done to prevent the spread in others. Therefore, it is primary level. What is quarantine? Quarantine is done for healthy, apparently healthy individuals. करते ये भी to prevent the spread, and therefore this is also a primary level of prevention. This is also a primary level of prevention. Coming to next point, like what are the different types of epidemic curves? Beta, if the disease will happen within one incubation period and comes down, it is called as point source. अगर वो ऐसा ऊपर नीचे चलता रहा, this is called as a continuous source, that is from multiple exposures, or we can have single exposure from a common source, So if the common source is given multiple exposures, it is continuous. If the common source is given single exposure, it is a point source epidemic. Propagated is जहाँ पे बहुत सारे लोग एक दूसरे को spread कर रहे हैं. So if you understand all this, let us come back to the MCQ. Quarantine is usually advised for a period of maximum incubation. Yes, it is the correct answer because ये करते ही incubation period के लिए till the time the person, what if the patient has the disease, है ना? Next is diseases like measles are not communicable during incubation. This is false answer because do you know that measles, beta? Do you know that measles in a child, measles, what is the peak age? peak age is roughly 0 to 3, it is roughly 6 months to 3 years. It is roughly 6 months to 3 years of age. And measles में there is no subclinical cases. No subclinical cases, and because there is no subclinical case, measles does not have iceberg. It does not have an iceberg phenomena because there are no subclinical cases. And measles में बेटा, do you know if this is the onset of rash? इस बच्चे को अगर रैश शुरू होता है, बच्चा will be infectious, can spread the virus even roughly around 4 days before the rash till 4-5 days after the rash. So before the onset of rash, the person is infective, and therefore we cannot say that it is not communicable. It is communicable. So this is the false answer. Next is immunization is during the incubation is useful. Yes, this is true. You must have heard about it that अगर किसी को चिकन पॉक्स एक्सपोजर हो जाए, चिकन पॉक्स एक्सपोजर हो जाए, इन चिकन पॉक्स और वैरिसेला बेटा, वी कैन गिव द ओका वैक्सीन. पेशेंट को क्या देना है आपने? यू हैव टू गिव देम ओका वैक्सीन. इट इज़ गिवन एज 0.5 ml की डोज जाएगी. इट इज़ गिवन एज सबक्यूटेनियस वैक्सीन, एंड यूजुअली 1 to 2 doses आर मोर देन सफिशिएंट with a gap of 3 months. It can be given with a gap of 3 months, OCA vaccine, and OCA vaccine should be given within 5 days of exposure to chicken pox. It is very important, especially for children who of that age who have not got chicken pox, who have not received have the natural infection. But of course, all said and done, beta, what do you think? हमारा इंसानों का बनाया हुआ vaccine will give better protection, or it will be the God-made vaccine? Obviously, the natural infection is going to give you better protection. But what vaccine we can give? OCA vaccine is effective during incubation period. And similarly, beta, measles में in measles we give the measles vaccine 0 dose. Measles vaccine 0 dose is given, and this is given to 6 months to 9 months of age children, and it is given usually within 3 to 5 days of exposure. It has to be given within 3 to 5 days of exposure. Measles vaccine. तो क्या हम vaccines देते हैं during incubation period? Definitely yes देते हैं. Right? Next is in case of point source, all cases occur within one incubation. ये तो just now you saw it ना, in a point source, that is a common source, and from the single exposure, all the cases will happen within one incubation period. So obviously this is also a correct answer or true answer. So which of the following is not true? अगर कोई पूछे तो obviously option B will be the best one for you guys to mark. Coming to the next MCQ, which of the following measures are followed by the National Vector-borne Disease Control Program to eliminate Kala Azar? What is Kala Azar? Kala Azar is visceral leishmaniasis. So options given to you are mosquito nets, RK39 rapid diagnostic kits, mass immunization, spraying pyrethroids, and insecticide treated nets. Which of the following? You think 1 only, 4, 5, 2, 4, 2, 3, 4, whatever. So what do you think is the best answer? What do you think is the best answer in this question? Which of the following measures are followed under National Vector-borne Disease Control Program to eliminate Kala Azar? A few points about Kala Azar, beta. What is Kala Azar? Kala Azar is visceral leishmaniasis. Visceral leishmaniasis. What is the investigation of choice? Investigation of choice is RK39, which is a serological test. What is the drug of choice? Patient को क्या देना है बेटा? Patient को even single dose injection amphotericin B, injection amphotericin B has to be given. It is called as LAMB. What is a LAMB? Liposomal amphotericin B. Even single dose is good enough for the child. So this injection is given. This is the drug of choice. What is the alternate investigation? The alternate investigation which is given is we can give tablet miltefosine. Miltefosine tablet can be given to the children along with paramomycin. Paramomycin. So this is the investigation of choice and drug of choice for काला आजार. अगर आप बात करें sand fly की, what is a sand fly? Sand fly is Phlebotomus argentipus. Phlebotomus argentipus. Phlebotomus argentipus, beta, that is what is the sandfly. Phlebotomus argentipus, it does not fly, it only hops. It hopping range kitna hai? It is roughly around 50 yards. And sandfly, it is a nocturnal biter, which is a painful bite. It is a very painful bite. It is a nocturnal biter, and it is a painful bite. It is a painful bite. Nocturnal biter है और ये painful biter है. And this is usually lives in cool, damp places. Cool, damp places. Sand fly. How do we kill a sand fly? To kill a sand fly, the insecticide of choice, that is synthetic pyrethroids. Synthetic pyrethroids, that is the insecticide of choice. Coming back to the MCQ, फटाफट से बोलिए, which one do you think is the best answer? So most of you are going with option C. C. Which of the following is followed under NVBDCP? Mosquito nets, beta, it's not useful for a sandfly, है ना? Sandfly doesn't work with the mosquito nets. RK diagnostic kits, absolutely correct. Spraying pyrethroids is correct. There is no immunization. Insecticide treated nets is not correct. So which is the best answer? You all have got it correct. It is 2 and 4. Let us go to next MCQ. 18-year-old male presents with contaminated wound on the right leg followed by a road traffic accident. He received complete tetanus immunization and last dose was 2 years ago. Which of the following should be done to manage this patient? 18-year-old patient. So which one do you think is the best answer for this question? Yeah. So there's a small update for you guys, that in case whenever you get a question on tetanus, beta, tetanus may you have to find out whether the wound is a clean wound or an unclean wound. Okay. If the person is immunized within 5 years, if the person is immunized within 5 years, what are we going to do for clean wound? Unclean wound, nothing has to be done. If the immunization is 5 to 10 years, for clean wound, nothing has to be done. For unclean, we give 1 tetanus का dose. एक single vaccine tetanus का हमें देना होगा if the person has taken immunization more than 5 years but within 10 years. अगर किसी इंसान ने more than 10 years, 10 साल हो गए उसको वैक्सीन लिए को, आफ्टर 10 years what do we do? अगर क्लीन वूंड है तो 1 TT का डोज वैक्सीन का लगेगा. अगर अनक्लीन वूंड है देन यू आर गोइंग टू गिव 1 TT डोज, सेम आंसर, एंड साथ में टेटनस इम्यूनोग्लोबुलिन. एंड साथ में टेटनस इम्यूनोग्लोबुलिन विल ऑल्सो भी गिवन. अगर पेशेंट ने 10 साल से ज़्यादा हो गए हैं उसने लास्ट टीकाकरण करवाए को, तो unclean wound में बेटा, this is pretty important, unclean wound we have to give the TTIG. What is TTIG? It is tetanus hyperimmunoglobulin. And common sense, if it is unknown or never immunized, then we have to give the complete immunization with TT or without TT immunoglobulin. So now this patient has taken last dose was within 2 years. So obviously in this case, what are we going to do? Nothing has to be done. This patient is category A. Category A for the wound management in tetanus. Okay. Coming to next MCQ. As a community nursing officer, you conduct a session on viral diseases that are more likely to affect the rice farmers. You focus on disease which is bird, arthropod, human transmission. Where humans are incidental dead end host, identify the disease. So options given to you are Ebola, Nipah, JE and Zika. Ebola, Nipah, JE and Zika. Which one do you think is the best answer? So it is, obviously most of you might be going correctly in this. Obviously most of you are going correctly in this. This is a bird arthropod human transmission. This is a bird arthropod human transmission. So which one do you think is the best answer for this kind of question? What do you think is the correct answer for this question? Yeah, it is. It is definitely a Japanese encephalitis. It is definitely a Japanese encephalitis. ये जो बीमारी है Japanese encephalitis की, ये how does it spread? बेटा, in this the Culex mosquito, that is the main vector. Culex will bite the bird and take the infection from the bird. There is a bird cycle. Birds, which birds are these? These are called as RD'd birds. RD'd birds, these work as maintenance host. Next is pigs जो हैं. What are pigs? Pigs will be the amplifying host. They are the main amplifier host. So the mosquito will bite the pig, take the infection. There is a pig mosquito pig cycle. And then humans, beta, these are the dead end host. Humans are the dead end host because they only take infection, they never give it back. They only take infection and they never give it back. This is what is the life cycle in JE. So obviously this, ये जो question है, ये भी यही बोल रहा है कि rice farmers थे. Rice farmers, paddy fields, beta. Please remember, whenever you get a question on paddy fields, always think of JE infection. Always think of Culex over there, because long standing dirty polluted water, it is paddy fields, it is JE. So what is the best answer? JE. इसमें बाकी ऑप्शंस गलत क्यों है? Why do you think? ये जो लाइफ साइकिल है बेटा, ये निप्पा का है. निप्पा वायरस जो है, निप्पा वायरस, it is through fruit bats. They are the natural reservoir. So या तो इंसान फ्रूट खाएगा which is infected from the fruit bats, या फिर वो fruit pig खाएगा and pig is going to amplify. So therefore human is, at the end of the day, they are going to get infection, and human may rarely spread it to other people as well, because it can spread through body fluids also. Right? So please note, this is the funda for Nipah virus. Nipah virus, what is the incubation period? 4 to 14 days is the incubation period. 4 to 14 days is the incubation period. Next is Ebola virus. Ebola virus कैसे spread होता है? It spreads through body fluids. Ebola virus will spread through body fluids. Okay. And what is the transmission for Zika virus? Zika virus, beta, it is transmitted by Aedes mosquito. And because Zika is through Aedes, that is not the correct answer in this case. Right? So what is the single best answer? It is JE. याद रखना JE के ऊपर बेटा, ये भी बहुत ज़रूरी है याद रखना, जापानीज एंसेफेलाइटिस के ऊपर, वैक्सीन के ऊपर सवाल आ सकता है. वैक्सीन, JE वैक्सीन, what is the type of the vaccine? It is a kolar strain killed vaccine. It is given as 0.5 ml intramuscular in the left anterolateral thigh. It is given in 2 doses, which is at 9 months of age and 16 to 24 months of age. Remember, these are frequently asked questions on JE vaccine, Japanese encephalitis. Going to the next MCQ, the correct sequence for Nalgonda technique is bleaching powder, lime, alum, alum, lime, bleaching powder, alum, bleaching powder, lime, lime, alum, bleaching powder. क्या बोलते हो? What is the correct sequence for Nalgonda technique? So what do you think is the single best answer over here? Beta, Nalgonda technique is used for what? Nalgonda technique will be used for defluoridation of water. Defluoridation of water. डिफ्लोरिडेशन ऑफ वाटर, इसका जो टेक्निक होता है दैट इज़ वेरी स्पेसिफिक टेक्निक. इट इज़ लाइम, alum and bleaching powder. It is lime, alum and bleaching powder. Remember LAB, lime, alum and bleaching powder. यही सीक्वेंस रहता है. ब्लीचिंग पाउडर, यही सीक्वेंस रहता है. दिस इज द सीक्वेंस यू हैव टू मार्क इन योर एग्जाम. फर्स्ट वी ऐड लाइम, देन alum, देन ब्लीचिंग पाउडर. प्लीज नोट, ये पुराना क्वेश्चन है. ये पुराना क्वेश्चन है. इट्स नॉट नेसेसरी कि जो जो क्वेश्चंस आपके नर्सिंग नेक्स्ट लाइव ऐप में थे सिर्फ वही आने चाहिए, है ना. यू शुड बी एक्सपोज टू न्यू MCQs ऑल्सो. और ये क्वेश्चन हमने वी हैव ऑलरेडी डिस्कस्ड इन द क्लासेस ऑल्सो, राइट. सो वी ऑलरेडी डिस्कस दिस इन द क्लासेस. सो आई नो कि जब भी मैं नया क्वेश्चन पूछता हूँ तुम लोग सब उल्टा पुल्टा हो जाते हो. तुमने पुराने नर्सिंग नेक्स्ट NNL वालों के पूरे क्वेश्चन रट रखे हैं. It should not be the scenario बेटा. You should read the explanations also. Don't think कि सिर्फ MCQ रट के एग्जाम में चले जाएंगे. रटना ठीक है, बिकॉज पता क्या होता है, नाउ यू हैव सीन दिस MCQ. अब ये चाहे मैं 5 साल बाद भी पूछूँ ना, 5 महीने, 6 महीने, 1 साल बाद भी पूछूँ, थोड़ा बहुत तो तुम्हें याद होगा. दैट इज़ वॉट इज़ द ब्यूटी अबाउट एन MCQ, दैट वंस यू ट्राई टू सॉल्व इट समहाउ वो याद रह जाती है MCQ. तो ये अपना ना एटीट्यूड को भी थोड़ा सा चेंज करना चाहिए कि यू नीड टू ट्राई टू सॉल्व न्यूअर MCQ. सो व्हाट इज द बेस्ट आंसर? LAB, lime, alum, bleaching powder. That is the single best answer you would like to mark for this question. Lab. Okay. अच्छा, काफ़ी स्टूडेंट्स ना पीछे पूछ रहे थे जापानीज एंसेफेलाइटिस लाइव है कि किल्ड है. बेटा जापानीज एंसेफेलाइटिस ओल्ड आंसर अगर आप करना चाहते हो यू कैन वेरी वेल डू. ये मैं कितनी दफ़ा बताऊँ, मुझे ये खुद सोच के बताओ ना. ये मेरे लिए सिर दर्द हो चुका है दैट हाउ मेनी टाइम्स आई हैव टू टेल यू दैट जो जापानीज़ में ओल्ड आंसर है वो लाइव वैक्सीन है. SA 1414-2. ये आई एम नॉट सेइंग बिल्कुल यू इट इज़ बैंड इन इंडिया, नहीं. न्यूअर जो स्ट्रेन आया है, न्यू वैक्सीन जो आई है दैट इज़ अ जेनवैक वैक्सीन. ओल्ड आंसर इज़ अ लाइव वैक्सीन. तो जहाँ जहाँ ओल्ड वैक्सीन पड़ी थी स्टॉक में वहाँ वहाँ वो दे रहे हैं. जब स्टॉक ख़त्म हो गया तो व्हाट इज़ द न्यू वैक्सीन विच विल कम? दैट इज़ द कोला स्ट्रेन. तो अगर आप याद करना चाहते हो ओल्ड आंसर आप कर लो, बट नॉर्मली पीपल विल आस्क यू अबाउट द न्यू आंसर. ओके, सो यही याद करना है, ये जरूरी है. Okay, about the Japanese encephalitis. Going to the next MCQ. A study was conducted on effectiveness of a keto diet for weight loss. ठीक है? A study was conducted on keto diet for weight loss. Weight of the participants was measured before starting the keto diet and 1 month of the keto diet. Which of the following is the most appropriate test? बताओ. A study was conducted on the effectiveness of keto diet. Weight of the participants was measured before starting the keto diet and after starting the keto diet. तो क्या लगता है बेटा? अगर आपको याद हो, I have told you about the test of significance. Tests of significance. It is a 10-star MCQ frequently asked in your exam. You have to find out whether the data is a quantitative or a qualitative. अगर quantitative है, what is the test of significance? Parametric. अगर qualitative है, what is the test of significance? Non-parametric. Single group, 2 groups or 3 or more groups. अगर single group आ जाए, 1 group आ जाए, what is the test of significance? अगर 1 group आ जाए, the test of significance we use is a paired t-test. It is a paired t-test. टेस्ट. अगर 2 ग्रुप्स आ जाएं बेटा, इट इज अनपेयर्ड टी टेस्ट. एंड अगर 3 और मोर ग्रुप्स आ जाएं, इट इज एनालिसिस ऑफ वेरिएंस अनोवा टेस्ट. प्लीज नोट, अनपेयर्ड टी टेस्ट इज ऑल्सो नोन एज इंडिपेंडेंट सैंपल टी टेस्ट. It is also called as independent sample t-test, also called as unpaired t-test. On the other hand, if you get a question on the non-parametric, whatever they may ask you, mark chi-square test. Mark chi-square test, that is usually the single best answer. अगर परसेंटेजेस में डेटा दिया है, परसेंटेजेस मतलब क्वालिटेटिव डेटा, अगर परसेंटेज में डेटा दिया है, ट्रिक ये रहेगा, if the percentage data is there, that is a qualitative, and if you can calculate the mean beta, if you can calculate the mean क्या होता है, what is mean is the average. If you calculate the average, अगर तुम average calculate करें, then it will be a parametric test. Average अगर आप calculate करो, then it will be parametric test. Make sure you get this right in your head. अगर आप ये समझ गए तो क्वेश्चन कह रहा है, हाईलाइट करो, व्हाट इज द क्वेश्चन सेइंग? क्वेश्चन इज सेइंग दैट वेट ऑफ पार्टिसिपेंट्स वाज मेजर्ड बिफोर एंड आफ्टर गिविंग कीटो डाइट. मुद्दा ये है कि भी हमने दी कीटो डाइट, पेशेंट का वेट चेक किया बिफोर एंड पेशेंट का चेक किया आफ्टर. सो हाउ मेनी ग्रुप्स आर देयर? वन ग्रुप ना. एंड ये आपने वेट चेक किया. व्हाट इज वेट? वेट इज quantitative or qualitative? It is a quantitative. So what is the best answer? It is paired T test. So absolutely correct. Most of you have correctly answered. It is a paired T test. सर मैं तो पूरा भूल जाती हूँ. बिल्कुल ठीक है आसमा, वेरी नाइस, आई एम सो प्राउड ऑफ यू. भूलना जरूरी है. भूलेगा वो बंदा जो इंसान पढ़ेगा. या तो आप नहीं पढ़ो तो आप नहीं भूलोगे. सो इफ़ यू आर फॉरगेटिंग, यू शुड बी प्राउड ऑफ इट दैट आप पढ़ रहे हो तभी तो आप भूल रहे हो. तो ये आई एम सो प्राउड ऑफ यू आसमा, यू हैव डन इट. भूलना अच्छी बात है. क्या होता है कि जब आप भूलोगे बेटा, आपने ये चीज़ यहाँ याद करी है, ओके, आपने ये चीज़ यहाँ याद करी है, फिर क्या होता है कि स्टूडेंट को लगता है कि हम यार भूल गए, देन इट मेमोरी गोज डाउन. तो जब वो मेमोरी डाउन करे, आप फिर से रिवाइज करो. जब आप फिर से व्हेन नेक्स्ट टाइम यू रिवाइज, यहाँ पे आपने क्या किया, यू स्टार्टेड योर रिविजन. चीज़ें भूल गए थे, जब आप रिवाइज करते हो बेटा, तो ये जो बेसलाइन जो था आपका, ये इंक्रीज हो जाता है. सो वो और डीपर लर्निंग, डीपर मेमोरी में जाता है, डीप जाता है. बट डीप में कितना डीप जाएगा? एक टाइम आएगा जब ये भी दोबारा भूल जाओगे. वो फिर भूल गए, हम यहाँ पे रिविजन नंबर 2 करेंगे. रिविजन नंबर 2 जब आप करते हो बेटा, इट विल गो डीपर इनटू योर लर्निंग, डीपर इनटू योर लर्निंग. एंड वंस इट गोज डीपर इनटू योर लर्निंग, तब इट यूजुअली स्टेज, यूजुअली अगर नॉर्मल इंसान है तो यूजुअली इट विल स्टे फॉर अ स्लाइटली लॉन्गर टाइम. भूलेंगे तो ये भी, ऐसा तो नहीं है कि ये नहीं भूलेंगे, भूलेंगे तो ये भी, फिर इसको हम फिर पढ़ेंगे. तो कहने का मतलब है, मैं आपको ये समझाना चाह रहा हूँ कि भूलेगा तो वो जो याद करेगा, तो ऐसे ही चलना है, ऐसे ही चलना होता है. एंड तभी आपको कोई बंदे बोलते होंगे दैट यू शुड डू मिनिमम 2 to 3 रिविजन्स करनी पड़ेंगी. एक दफ़ा पढ़ने से काम नहीं बनता. एंड वो याद करेंगे, हम भूलेंगे, हम फिर याद करेंगे, हम फिर भूलेंगे, हम फिर याद करेंगे, हम फिर भूलेंगे, हम फिर याद करेंगे. एंड दैट इज़ द रीज़न पीपल विल से कम पढ़ो पर बार बार पढ़ो. ज़्यादा पढ़ लिया, एक दफ़ा पढ़ा, इट इज़ नॉट बेटर. डोंट रीड 5 books one time, रीड 1 book 5 times. याद रख लो ये बात कि ये ऐसे ही चलेगा. ये रिवाइज जब तक आप करेंगे वो बड़ा ज़रूरी है. सो अभी आपके पास सिर्फ 5-6 दिन बचे हुए हैं एग्ज़ाम से. 5-6 भी क्यों, मतलब जितने भी दिन, 2-4-5 दिन बचे हुए हैं. सो दैट्स ओके. एंड एग्ज़ाम से पहले ये फीलिंग आनी कि हम भूल गए हैं, विच इज़ वेरी गुड बेटा. आई लाइक दिस. एंड जो बंदा पढ़ाई किया वही ऐसे बोलता है. जिसने नहीं पढ़ा ना, उसका एटीट्यूड देखना हो तो कहेगा अपन तो कूल है. सो वो उसको तो कुछ मतलब दे डोंट हैव टू वरी अबाउट एनीथिंग बिकॉज दे आर नॉट फॉरगेटिंग एनीथिंग बिकॉज दे डिडंट लर्न एनीथिंग. सो व्हाट इज़ द बेस्ट आंसर? ये जो वेट है बेटा, वेट, व्हाट इज़ वेट? वेट इज़ अ पेयर टी टेस्ट. एंड आई बेट यू, इसमें मेरी बात को लाइटली मत लेना. आप भूल रहे हो बट आपके जो मेमोरी है यहाँ पे सबकॉन्शियसली वो पड़ा हुआ है. जब आप एग्ज़ाम मोड में आएंगे, यू विल ऑटोमेटिकली रिमेंबर, फ्लैशबैक की तरह वापस आएगा. ओके सो याद रखें कि ऐसे बहुत अच्छी बात है that you're forgetting, and this is good. डर होना ज़रूरी है. So please note the best answer over here is a paired T test. Going to the next MCQ. हाँ 3 days only या 4-5 भी मैंने ज़्यादा बोल दिए. So a researcher studies just 2-3 MCQs more, nothing much, 2-3 MCQs more. A researcher studies the risk factor for sudden cardiac death in young athletes by examining 150 athletes who have died suddenly and 300 who did not, reviewing their medical records. All of the following is true except आपको झूठ वाला बताना है. क्या बोलते हो? आपको झूठ वाला बताना है. यू हैव टू टेल द रॉन्ग वन. सो यहाँ पे what the question is doing, they have examined 150 athletes जिनका डेथ हो गया suddenly and 300 who did not die. And these are my two groups, 150 and 300, and we reviewed their medical records to identify the factors. So simple भाषा में I can help you learn that 150 death हुआ ले लिया and 300 you took who are still alive and you check their medical records. You check their medical records for finding out some contributory factors. Contributory factors. Okay. So what is this study design? Is it a case control or a cohort? Obviously you're starting with the outcomes and you're going back. आप पीछे की तरफ जा रहे हैं. So पीछे की तरफ जा रहे हो. You're going from risk factors will lead to disease. So case control में कहाँ से शुरू करते हो? You're starting with the disease and you go back case control में. Because you go back, this is a case control. अब बताओ, it is efficient for studying rare disease. Case to control ratio 4:1 will increase power. Incidence and risk can be measured. Recall bias is minimum. Is potential limitation. What do you think? Anshika, absolutely correct. So correct. With explanation you have given it. Very, very good. Very, very nice. So this is incidence and risk ratio can be measured. Why beta? In a case control study, what do you start with? In a case control study, we will start with cases and we'll start with controls. And in cases controls में हम देखेंगे who were exposed, non-exposed, exposed, non-exposed by studying different factors. So remember 3-4 important points in a case control study. You can study what? Multiple outcomes or risk factors. Multiple risk factors can be studied. And because multiple risk factors can be studied, therefore case control is the study of choice. It is a study of choice for rare diseases. It is the study of choice for rare disease. Case control study, it is from cause to effect or effect to cause. It goes from effect to cause. You go from effect towards the cause. पीछे की तरफ जाते हो and पीछे की तरफ जाने को retrospective study बोलते हैं. And in a case control study, you find out odds ratio. Odds ratio equal to 1 means no association. More than 1, it means a positive association. And if it is less than 1, it means a negative association. So these are few 5-star, 10-star points you would like to remember for your exam. That what do we mean by case control studies, cohort studies, and all these things. Yeah, so now what is the single best answer you would like to mark? It is efficient for studying the rare disease. True or false? It is true. Cause to case control ratios up to 4 is to 1. Yes, this is also true because beta if you have more controls compared to the cases. ओके अगर आपके पास कंट्रोल टू केस रेशो कंट्रोल्स ज़्यादा हो जाएं सो सैम्पल साइज बढ़ जाएगा एंड बिकॉज 4:1 ले लेते हैं दिस इज द हाइएस्ट लेवल वी कैन रीच यू कान टेक 10:1 20:1 नो इट डजंट वर्क दैट वे सो 4:1 लेना है 4:1 इज गोइंग टू इंक्रीज द स्टैटिस्टिकल पावर बिकॉज आपका सैम्पल साइज अप्रोप्रिएटली बढ़ जाता है बस दैट्स इट सो इट्स अ वेरी सिंपल क्वेश्चन right? It's a very simple question, simple answer. So case control ratio में 4 controls and 1 will increase the statistical power. This is true. Incidence and risk ratio can be measured. This is false. Why? Because ये कहाँ पे measure करते हो cohort study में. Recall bias is a potential problem. This is also a true answer. So which is the only one which is false? Option C. Let us see आपके doubts. सर क्वेश्चन में रिस्क फैक्टर नो रिस्क फैक्टर है कोहॉर्ट स्टडी रिस्क फैक्टर नो रिस्क फैक्टर कहाँ है बेटा यू आर स्टार्टिंग विद द डेथ्स एंड द अलाइव ये क्या है ये तो आउटकम है ना यू स्टार्टिंग विद द आउटकम एंड यू गो बैक टूवर्ड्स द रिस्क फैक्टर इन कोहॉर्ट वी गेट द इंसिडेंस यस राइट सो दिस इज अ केस कंट्रोल स्टडी This is a typical example of a case control study and the single best answer you would like to mark is option number C. Okay, चलो अगला क्वेश्चन देखो which of the following correctly matches the level of monitoring under the National Iodine Deficiency Disorder Control Program with the indicator assessed. Primary level is for urinary iodine excretion, secondary for iodine salt, tertiary for TSH, quaternary for T3, T4. क्या बोलते हो क्या बोलते हैं इट्स अ डायरेक्ट क्वेश्चन डायरेक्ट आंसर अंडर NIDDCP नेशनल आयोडीन डेफिशिएंसी डिसऑर्डर कंट्रोल प्रोग्राम सो इसमें बेटा हमारे पास 3 चीज़ें होती हैं वी चेक द सॉल्ट आयोडीन इन सॉल्ट वी चेक द यूरिनरी आयोडीन एक्सक्रीशन एंड वी ऑल्सो चेक हाउ मेनी न्यू बॉर्न्स आर देयर विद न्यूनेटल हाइपोथायराइडिज्म ये 3 चीज़ें चेक करनी है ओके सो प्राइमरी इसमें होता है आयोडीन कंटेंट ऑफ सॉल्ट दैट इज द प्राइमरी थिंग द सेकेंडरी लेवल पे वी विल चेक द यूरिनरी आयोडीन एक्सक्रीशन एंड टर्शरी लेवल ऑफ स्क्रीनिंग इज नियोनेटल हाइपोथायराइडिज्म और TSH स्क्रीनिंग सो विच इज द सिंगल बेस्ट वन अगर आप ये समझते हो विच इज द सिंगल बेस्ट वन फॉर यू गाइज टू मार्क इन द एग्जाम विच इज द सिंगल बेस्ट वन फॉर यू गाइज टू मार्क इन द एग्जाम कौन सा बोलना चाहते हो I lost the question. Yeah. So which is the single best answer? Primary level is urinary iodine excretion. No, this is false. This is secondary. Secondary is iodization of salt. This is primary. This is false. Tertiary is T3. Yes, this is true answer. Quaternary कुछ नहीं होता T3, T4. So this is the single best answer for you guys to mark that which of the following is the correct answer. Coming to next, which of the following is not an indicator used in Global Hunger Index? Which one do you think is not an indicator used in Global Hunger Index? Undernourishment, child below poverty, underweight, child mortality. Which one is not an indicator used in Global Hunger Index? So please note what is a global hunger index. Global hunger index में 3 चीज़ें हैं 3 dimensions are there and in the 3 dimensions there are 4 indicators. First dimension is child mortality. Second dimension is child undernourishment or undernutrition. Third indicator is inadequate food supply or total population undernourishment. This is total population. It refers to the entire population. Total population undernourishment. So ये 4 indicators हैं बेटा 3 dimensions है एंड इन 4 इंडिकेटर्स में क्या क्या चीज़ें हैं? इन अ ग्लोबल हंगर इंडेक्स वी हैव अंडर 5 मोर्टालिटी रेट, we have wasting rates, and we have stunting rates, and we have total undernourishment rates. Okay, in 4 indicators में 4 indicators में these 2 indicators are basically belonging to child undernutrition. So obviously, which is the single best answer, which is not an indicator used in the global hunger index? Undernourishment, yes or no? Yes, this is correct. Child below poverty line, no, this is not a correct. This is the false because हम इसमें poverty तो देख नहीं रहे. Underweight, yes, this is including child mortality. Yes, it includes. So which is the single best answer for you guys to mark? It is child below poverty line. It is child below poverty line. That is not the correct answer. That is the option B is the single best answer. Right? Going to the next MCQ, which of the following is not correct? Epidemiology का question है, which of the following is not correct? Population is the unit of study in ecological study. Individual is the unit of study in cross-section study. Incidence is calculated in cohort study. Multiple disease outcomes are calculated in case control study. So which one do you think is not correct? So abhi to we discussed this. We just now discussed this. Which of the following is not correct? If we talk about ecological studies, इसमें the unit of study is population, and ecological study is also known as a correlational study. Okay, अभी हमने बात किया केस कंट्रोल स्टडीज का. केस कंट्रोल इंडिविजुअल के ऊपर बेस्ड होगा, एंड दिस इज ऑल्सो नोन एज अ रेट्रोस्पेक्टिव स्टडी. एंड बिकॉज रेट्रोस्पेक्टिव स्टडी है, अभी आपने 5 मिनट पहले बात किया that multiple risk factors can be studied. So obviously, if you understand this, in this multiple disease outcomes are calculated in a case control study. True or false? This is false because it is not the multiple disease outcomes. You can calculate the multiple risk factors in the study. Multiple risk factors can be studied. So isme population is the unit. Yes, this is true. Individual is the unit in a cross section study. Cross section study, 2-4 बातें. Cross section study is also called as a prevalence study. इसको हम prevalence study भी बोलते हैं cross section study को. And prevalence study हमेशा at a single time, it is also called as the snapshot of population. It is also called as the snapshot of the population. Next is incidence is calculated from a cohort study. Absolutely correct. Cohort study क्या होती है? Cohort study is a prospective study. Cohort study is a prospective study, and cohort study is long time taking. It goes from effect to cause या cause to effect. फटाफट से लिखिए चैट बॉक्स में. Cohort study cause to effect or effect to cause? It is from cause to effect. And यहाँ पे बिल्कुल ठीक कह रहे हैं आप. Cohort study is for multiple diseases. Why? Because you start with the risk factor and no risk factor, and in May you can see that people who are smoking, they will get cancer, they can get chronic bronchitis या क्या चीज़ें होंगी. That is what we call as a cohort study. Right? This is what we call as cohort study. So option D is the only one which is wrong answer. That is the only one which is wrong answer. So obviously option D is the wrong answer. Yeah, selection bias, beta, selection bias कहीं पे भी हो सकता है. We can even find it in cohort study or case control study. So very nice. It had been such a wonderful thing to interact with you guys. And these were few topics. इसके अलावा बेटा, there is one more topic which is not a part of the MCQ. That is other topics I would like you to revise. other topics which are important for you to revise बेटा। एक सबसे पहला जरूरी है बायोमेडिकल वेस्ट मैनेजमेंट। बायोमेडिकल वेस्ट मैनेजमेंट में मेक श्योर यू रिवाइज इट। दो चार बातें मैं आपसे सवाल पूछता हूँ, आप चैट बॉक्स में लिखना, एंड आई विल कीप ऑन टॉकिंग अबाउट अदर थिंग्स। आपके लिए एमसीक्यू है बेटा, फटाफट से बोलो कि वैक्यूम टेनर किस में डालोगे, यूरिन बैग किस में डालेंगे, ग्लव्स विद ब्लड किस में डालोगे, ग्लव्स स्टेन्ड विद ब्लड, कॉटन सोक्ड विद ब्लड, ब्लड स्लाइड्स किस में डालेंगे, एंड सिक्स्थ इज कैनुला किस में डालोगे, कैनुला किस में डालोगे। 6 एमसीक्यू दे रहा हूं बायोमेडिकल वेस्ट के ऊपर, ट्राई टू आंसर मी वेरी वेरी फास्ट। सो एक तो बायोमेडिकल वेस्ट पढ़ के जाना, दूसरा बेटा रिकमेंडेड डाइटरी अलाउंस न्यूट्रिशन में ज़रूरी है। थर्ड, इफ़ यू वुड हैव हैड माई वर्कबुक, अगर आपके पास वर्कबुक है मेरी, उस वर्कबुक में बेटा हमने लाइव क्लासेस में भी बात किया, ऑनलाइन में भी बात किया। देयर इज़ अ टेबल अबाउट द डिवाइसेस विच आर यूज्ड इन एनवायरनमेंट, डिवाइसेस विच आर यूज्ड इन एनवायरनमेंट। सो ये एक 5 स्टार 10 स्टार टॉपिक है, ये जरूर पढ़ के जाना एनवायरनमेंट के ऊपर। फोर्थ आता है ईएसआई प्रोग्राम। ईएसआई प्रोग्राम के ऊपर काफ़ी सारे सवाल आते हैं। ईएसआई व्हाट आर द बेनिफिट्स, 2-4 सवाल तुमसे ईएसआई के भी पूछ लेता हूँ। ईएसआई में जल्दी जल्दी बताना है दैट व्हाट इज़ द मैटरनिटी बेनिफिट फॉर 4 वीक्स, 4 वीक्स के लिए किस केस में मैटरनिटी बेनिफिट मिलता है। सेकंड, एक्सटेंडेड मेडिकल बेनिफिट इज़ फॉर हाउ मच टाइम, इज़ फॉर हाउ मेनी डेज और मंथ्स, कितना टाइम के लिए। एंड थर्ड आपने बताना है एनहांस्ड मेडिकल बेनिफिट कितनी देर के लिए है। एंड फोर्थ आपने बताना है कि व्हाट इज़ द मिनिमम पे, व्हाट इज़ द कंट्रीब्यूशन by the employee, सो ये 4 सवाल आपने करने हैं, ये 4 सवाल करने हैं। प्लीज़ राइट डाउन 1 2 3 4, अदरवाइज हाउ विल आई कम टू नो तुम किसका आंसर कर रहे हो। सो मुझे पिछले वालों का आंसर्स मिला है बायोमेडिकल वेस्ट का। सो बायोमेडिकल वेस्ट के आंसर्स हैं 1 2 3 इन रेड, 4 इन येलो, 1 2 3 इन रेड, 4 इन येलो, 5 किसी ने बोला नहीं, ब्लड स्लाइड्स वाइट में डाली हैं किसी ने, एंड कैनुला भी किसी ने नहीं बोला। प्लीज नोट आई एम गिविंग यू द आंसर्स नाउ। आंसर्स आर बेटा वैक्यूटेनर हैज़ टू गो टू द रेड कैटेगरी बिकॉज वैक्यूटेनर विद ब्लड आएगा तो येलो, यूरिन बैग इज अ रेड कैटेगरी, ग्लव्स विद ब्लड, एनीथिंग विद ब्लड गोज टू येलो, बट प्लीज नोट ग्लव्स जो हैं बिकॉज ग्लव्स हैं इट विल गो टू द रेड कैटेगरी। कुछ नहीं करना, धो लेना है ग्लव्स को, द वाटर विल गो टू द फ्लूइड कैटेगरी एंड ग्लव्स विल गो टू द रेड। Cotton soaked with blood, it again goes to the yellow category. Please remember, it's a yellow category and no pre-treatment. No pre-treatment is required. Blood slides, they do not go to the yellow, they go to the blue category. And cannula, it goes to the red category. Coming to the ESI, आप लोग ESI के भी आंसर्स कर रहे हैं बेटा। Maternity benefit 4 weeks के लिए किसके लिए मिलता है? It is any medical condition, very good, it is for any medical condition. Extended medical benefit किसके लिए होगा? Extended medical benefit is for how much time? Extended medical benefit is for 2 years बेटा। Enhanced benefit किसके लिए है? It is for 7 days for tubectomy and it is for 14 days for vasectomy. Sorry, opposite हो गया, उल्टा हो गया। It is 7 days for vasectomy. It is 7 days for vasectomy. Male के लिए it's only for 7 days and female के लिए tubectomy it is 14 days. Tubectomy is 14 days. Contribution by the employee कितना होता है? It is 0.75% on monthly basis. जो employer है they will contribute 3.25% of the monthly wage. सो प्लीज़ नोट कि ये आपके इम्पॉर्टेंट टॉपिक्स हैं. ESI हो गया. फिफ्थ इज़ ऑल द recent schemes by Government of India, especially the mother child health schemes, specifically the mother child health. Sixth is most important, biggest topic. Do study PMJ, Jan Arogya Yojana, Ayushman Bharat scheme, Ayushman Bharat scheme, Ayushman Arogya Mandirs, what is the health and wellness center, and CHOs का रोल क्या है यहाँ पे. CHO कम्युनिटी हेल्थ ऑफिसर का रोल क्या है. आयुष्मान आरोग्य मंदिर स्कीम, आयुष्मान भारत स्कीम, एंड प्रधानमंत्री स्वास्थ्य समग्र मिशन, प्रधानमंत्री प्राइम मिनिस्टर स्वास्थ्य समग्र मिशन, विच वॉज द ओल्ड नेम फॉर द नेशनल हेल्थ मिशन. रिसेंट स्कीम्स में मदर चाइल्ड हेल्थ स्कीम, एंड कोई अभी शुरू में पूछ भी रहा था पोषण स्कीम के बारे. सो पोषण अभियान, पोषण स्कीम्स, रिसेंट मदर एंड चाइल्ड हेल्थ स्कीम्स, एंड गवर्नमेंट ऑफ इंडिया का जो PHC CHC सिस्टम है, PMJ, आयुष्मान भारत, and स्वास्थ्य सुरक्षा योजना, all these are pretty important new schemes by government of India. So these are some of the things which I think should be done. And of course हमने बात किया है, 7th point is levels of prevention. लेवल्स ऑफ प्रिवेंशन, ये तो मतलब जग जाहिर बात है. 8वां पॉइंट बेटा, अगर आपने वर्कबुक देखी हो तो उस वर्कबुक में if you see the topic about the infectious disease epidemiology, that is a 100-star MCQ. उसमें you have to remember those 16 points. याद है ना वो 16 points in workbook. You remember 15-16 points है वहाँ पे infectious disease epidemiology के लिए. So वो एक ज़रूरी है आपको याद रखना कि what is attack rate, population attack rate, what is PQLI, disability indicators. उसमें हमने सारे PSM की all the definitions we had discussed. So make sure that you study all these. हाँ, अनीमिया मुक्त भारत बेटा, अनीमिया मुक्त भारत, it is the dose is अनीमिया मुक्त भारत, the dose is 60 milligram and 500 micrograms to be given as daily tablets. Please note this is for pregnant and lactating females. और जो adolescent children हैं, adolescent girls हैं, उनके लिए भी 60 and 500 micrograms है, but this is given as weekly tablets. It is called as WIFs. What is WIFs? Weekly iron folic acid supplements. It is WIFs, that is weekly iron folic acid supplements. Please note it is not 100 and 500. ये गलत आंसर है. This is wrong answer. It is not 100 and 500 in WIFs. It is same. Right? So जिन लोगों ने क्लास अटेंड करी है, they very well know what I am talking. कि वर्कबुक से भी आपको वो 15-16 पॉइंट्स है, मेक श्योर यू स्टडी दैट एंड गो. उसमें से क्वेश्चंस आएगा बेटा. 3-4 दिन रह गए हैं, पढ़ लो फटाफट से. और ये सिंड्रोमिक किट वगैरह बेटा देख लेना. आई डोंट हैव एनीथिंग टू टेल यू. और बाकी जो मैंने 5 स्टार मार्क किए थे उनको एक दफ़ा जस्ट मेक श्योर. वो 5 स्टार मजाक में नहीं है 5 स्टार, वो असल में 5 स्टार चीज़ें होती हैं. एंड वही चीज़ बार बार पूछते हैं. एंड पूरी आपके पास ऑलरेडी बेटा कम्युनिटी हेल्थ नर्सिंग में यू ऑलरेडी हैव ऑल द मटेरियल. बाकी चीज़ों के पीछे इतना भागने की ज़रूरत नहीं है. और भूल गए तो कोई चक्कर नहीं है, दिमाग में याद रहेगा. एटलीस्ट कम्युनिटी हेल्थ नर्सिंग आपका स्ट्रॉन्ग सब्जेक्ट हो जाएगा. आई नो इट. एग्ज़ाम में देखना सुपर डुपर ईजी होगा आपका एग्ज़ाम, एंड यू वोंट गेट बाउंसर्स इन एग्ज़ाम. ओके, आराम से जाओ, कोई टेंशन नहीं लेनी है, एंड इट विल बी ऑल फाइन. सो डोंट वरी अबाउट एनीथिंग. ठीक है. चलो. Yeah, so with that I think we finished the whole task, and Yeah, you remember the mnemonic good girl with red blue Yankee bag. Of course, all praise for you guys, and कुछ भी हो, it'll be a proud privilege with for us कि आप लोग एग्ज़ाम के बाद ज़रूर हमें बताएं that how was your exam. देखो, जितना आप लोग एग्ज़ाम पास करना चाहते हो उससे ज़्यादा बुरी तरह हम लोग चाहते हैं कि आप लोग एग्ज़ाम पास करो. So this is what is actually required by most of us. All the faculties pray for your success, and we just hope कि आप लोग you clear the exam with brilliant marks and flying colors. And सच बोल रहे हैं कि जितना नहीं, सच में है ये बात कि जितना आप लोग बुरी तरह एग्ज़ाम क्लियर करना चाहते हो उससे ज़्यादा नर्सिंग नेक्स्ट लाइफ की टीम एंड फैकल्टीज दे वांट यू टू क्लियर द एग्ज़ाम, बिकॉज एट द एंड ऑफ द डे दिस इज़ व्हाट इज़, हमारे पास भी तो यही चीज़ है ना कि स्टूडेंट सक्सेस बोलना है. सो वंस यू क्लियर योर एग्ज़ाम एंड वंस द एग्ज़ाम इज़ ओवर, ये मेरे अते पते हैं बेटा, कहीं पे भी इंस्टाग्राम, फेसबुक, टेलीग्राम, एनी टाइम you can just contact me, and I'll be more than happy to help you all. I wish you all the very best of luck and go with full confidence. कुछ नहीं है, easy होगा एग्ज़ाम. Community health nursing, you have done it very nicely and I'm already very proud of you, right? चलो, वेरी नाइस. तो मैं बोल रहा था ना कि जो स्टूडेंट कम्युनिटी हेल्थ नर्सिंग ढंग से उस 5-7 दिन में पढ़ लोगे तुम लोग, वो हमेशा के लिए याद रह जाना. एंड वो जो हमेशा के लिए याद रह गया, देन दिस विल बिकम योर पावर सब्जेक्ट इन योर एग्ज़ाम. चलो, ऑल द वेरी बेस्ट बेटा, एंड ज़रूर हमें याद रखना फॉर टेलिंग अस अबाउट हाउ योर एग्ज़ाम वेंट वेल, कैसा गया. और क्लासेस होंगी CHN की? नहीं बेटा, अब और मेरा तुमको पढ़ाने का कोई मतलब नहीं है. तुम लोग नॉर्सेट एग्ज़ाम क्लियर करो और जाओ यहाँ से. दैट इज़ व्हाट वी वांट. चलो, ऑल द वेरी बेस्ट बच्चे. थैंक यू सो मच. चलो, दैट्स सो नाइस. ऑलरेडी गॉट 82 इन RRB. प्रवेश, वेरी नाइस. RRB का भी तो एग्ज़ाम था जब मैं शायद आया था, तब दैट टाइम इट वाज योर RRB एग्ज़ाम. चलो, ऑल द वेरी बेस्ट गाइस. स्टार्ट स्टडिंग नाउ. अभी और टाइम नहीं वेस्ट करना. बस ठीक है, थोड़ा सा रिलैक्स कर लो 5-7 मिनट, बट गेट बैक टू स्टडी. अभी कोई रुकने का टाइम नहीं है. एंड कुछ घंटे ही बचे हैं एग्ज़ाम में. ऑल द वेरी बेस्ट बच्चे. टेक केयर. बाय बाय.